Go.
Busy there. Is it all happening at ANZ there, Josh?
Yeah, it's really busy here today, actually. Yeah, it is. It's good though. Although there's rain tomorrow, so it's funny how now when there's rain, people are like, "Oh, I don't think I'll come into work now because there's rain." So
Yeah,
I'll work from home.
it's a crazy phenomenon.
So we think that's going to happen tomorrow, but we'll see how we go. I'll just give it a couple more moments there, guys. Comes up all right, the new branding there, Trent, the new colours. Yeah, looks good.
Love the new branding. Sensational. Definitely a good freshen up.
Now, if you're just jumping on, feel free, grab your lunch if you like, grab a cup of tea or a coffee or whatever floats your boat. We will start in a moment or two. And no doubt, if you're listening to this recording as well, feel free to do the same, depending on what time you're dialing in. But yeah, Trent and I will be going through the session today. We're both from Pinnacle Health Group. We're going to talk a lot about measuring employee wellbeing, and specifically the things that you can measure to really help sort of make sure you're honing in on the right things with your employee wellbeing program. So yeah, if you're just jumping on, feel free to grab a bite to eat or anything. There will be lots of time for questions throughout the session, but also feel free to stop us at any point in time and ask any questions that you like. Let's give it another 20, 30 seconds or so, and then we'll get cracking. I don't think we've had any issues with the links today, so that's a good start. Okey-doke. Well, we might make a bit of a start anyway, and thank you for those that have jumped on, for those that are listening to the recording. Also, thank you for getting involved. As I touched on just at the start before, whilst we were waiting to get cracking, my name's Josh Lambert, and I have Trent Marsh here as well from Pinnacle Health Group. We're going to go through the session today and talk a lot about health checks and a lot about measuring employee wellbeing. Usually these sessions, we run these sessions once a month, and they are generally quite intimate sessions. We want you to ask questions. There's going to be some questions that we ask of you to get involved as well. And really, you get out of this session what you ask and what you put in, and it's something that that sometimes the less formal they are, the better. So that's what we want to achieve today. So yeah, thanks for jumping on, and let's get cracking straight away. All right, so we're going to go through today, we're going to go through what a health check is. And again, you may already know what a health check is, and you're just looking at more refining your approach to health checks. We'll talk about why we deliver health checks in a workplace setting or for your business or wherever it is that you may come from. We'll talk about their role in broader workplace health or broader employee wellbeing. And then really, to cut to the chase, I suppose, what a lot of you might be here for is how to deliver them. And that's probably our strength. Our strength is more on the practicalities of getting this done. And then finally, we'll sort of come home pretty strong with where health checks and measuring wellbeing fit in with broader wellbeing in this year and beyond. We'll talk a bit about hybrid working. We'll talk about remote working and probably the role of health checks and how to scale that. So yeah, thanks again for those that have jumped on, and for those that are listening to the recording. Hopefully you get a bit out of it. So let's get cracking. Now, apologies, Trent. I've got a picture of myself there and Tom, but I didn't pull up one of yourself as well there. But as I touched on before, my name's Josh Lambert. I'm a director of Pinnacle Health Group with my business partner, Tom Bosner, in the bottom left corner. Trent, who is on the call here, is the National Health and Wellness Manager at Pinnacle Health Group. And yeah, what we do at Pinnacle Health Group is our whole focus, our whole aim is to inspire healthy change for workplaces. We work with over 200 individual workplaces at the moment. They range from some large, well-known organisations like ANZ Bank, which is where I'm dialing in from today, to Westpac and EY, which is where Trent spends a bit of time up in New South Wales, right through to small businesses and startups and so on. So we really specialise in wellbeing programs and inspiring healthy change in workplaces. So that's our gig and what we really love doing, which hopefully will come through in us today. To break it down a bit further, and this isn't so much of a sales pitch to say, hey, you should speak to Pinnacle Health Group, but more just to give some justification as to what it is that we do. So when we talk through health checks, the importance of measuring wellbeing, you can get some context as to our learnings. But for over 12 years now, we've been working with those 200 workplaces on wellbeing strategy, so designing wellbeing programs for the employee base. Wellbeing programs, so not just the strategy or the concept, but the actual things or the initiatives that are being delivered, and delivering on-site wellness centres. So I'm actually dialing in from one of our on-site wellness centres here at ANZ Bank today. We have a few of these across Australia, and they're certainly an extension of what it is that we do. But really, the main highest volume program or thing that we deliver, or initiative we deliver at Pinnacle Health Group, are the wellbeing programs, and that's really what we're going to hone in on the most today. So thanks again for those that have joined us, and we will get moving. So before we sort of progress into today's session, which is all around health checks and measuring wellbeing, I just wanted to flag again, not so much plugging Pinnacle Health Group and what it is that we do, but outside of the 200 workplaces that are clients of ours, we've developed a Well Workplaces community. So if you already receive a lot of our content and you've listened to the podcast, well, don't worry, you can ignore what I'm about to say. But if you haven't, do yourself a favor. It's a really great podcast to listen to. It's called Well Workplaces. Tom, who, as I touched on at the start, is my business partner. He interviews a whole range of different experts, from wellbeing service providers, from leaders in HR and health and wellbeing across Australia and internationally. There's 70 odd different episodes of this podcast up to date, and each one is so unique. And there's really something that if you're a leader, if it's your job to design and deliver the wellbeing program, if you're an employee and you'd like to listen to some facts and information, improve your own personal wellbeing, there really is something for all of you there. So yeah, jump on the Well Workplaces podcast or join the community, because there's lots of good stuff on that. All right, that finishes all the sort of, as I said before, it shouldn't have sounded like too much of a sales pitch, hopefully, just to give you an idea of what it is that we do at Pinnacle Health Group. Now, if you've ever jumped on one of our masterclasses, as I said at the start of the session, we like them to be quite intimate and personal. So feel free, grab some lunch, share your screen if you like, stop us and interrupt us at any point to ask questions. But what we're going to start with, we're actually going to ask some questions of you throughout this session, just to get a gauge as to what it is, some of the challenges that you might face, or where health checks might fit into your workplace wellbeing program. So the first question we're going to ask you here is, what challenges have you faced in measuring the wellbeing of your workplace? Now, to answer that question, we use an app called menti.com or Mentimeter. So what I'll get you guys to do, if you can, is either open up another tab on your desktop or jump on your phone, go to menti.com, and it will ask you to type in a code. The code that you can see there is the one up the top here, so 84527845. And if you type that code in, that will literally ask you the same question that I've just asked you, and you can answer that. So really what we're asking here is, what challenges have you faced as an organisation, as a leader, as someone who's responsible for the wellbeing program, in measuring the wellbeing of your workplace? So feel free, jump on that and throw in your input to that. I'll give you a few moments to get that organised. And for those that are watching this on the recorded version of it, obviously you won't be able to do this, but you'll be able to see the responses from some of the other participants. But a good question to ask yourself, you know, what have you struggled with, or what has prevented you from measuring wellbeing in your organisation up until this point in time? So I'll just give a couple more moments there for you to fill out your responses. And as people complete these, you'll see some of the words that come up. So challenges, connection. Yeah, that's a really good one, particularly over the last couple of years. Lack of data. Absolutely. That's a really good one. Sometimes a lack of data, sometimes too much data, or wide-ranging data that doesn't link together. That's a really, really good point. Thank you for submitting those responses. Got a couple that have popped those in there. We might give it a couple. We've only got a nice little intimate crowd today anyway, so we might you feel free just to take your time filling those in. But just to come back to the question that we're asking there really is, what challenges have you faced in measuring the wellbeing of your workplace? So if you're either completing this at the moment or you're watching the recording, really that, you know, to measure wellbeing can be quite wide ranging. So the two responses here, connection and lack of data, well, they kind of go hand in hand. So, you know, if you're just coming into it, if you're a workplace leader who's responsible for delivering health checks or for using information and then making decisions, often there's a lack of data. You know, have health checks been delivered, or do we have survey information? Do we have any metrics around the wellbeing of our organisation so I can then make decisions as a leader? That's clearly a challenge, and that's probably the most or the biggest challenge that most people face, is really not having sufficient information to make decisions. The second one, just to speak of connection there, is that there can be connection in actually gathering that data or having that data there in the first place, but it can be connection with employees in actually measuring the data moving forward. You know, back in, I shouldn't say the olden days, when we were all in the workplace and delivering things like flu vaccinations and health checks on site in the workplace was really, you know, easy to do because everyone was at work every day. That's obviously very different now. So whilst we are connected very well with technology, that in-person connection and the ability to gauge how people are going, you know, to look at how mentally well and how physically well our colleagues are, we don't have that same level of that at the minute. So there's some really good responses there, and no doubt if you're listening to this and watching on, you've probably got some of your own barriers that you'd speak of as well. All right, so before we move into the next stage, did anyone have any questions so far around measuring wellbeing, or want to share some of the challenges that they've been through, or barriers to wellbeing in their own personal context? All good. And I guess, Trent, just to throw a question to you here as well, working with lots of organisations, do you find any common themes of barriers or challenges that your clients might have when measuring wellbeing of their staff?
Good question, Josh. I think probably the one that springs to mind the most for me is obviously the hybrid workplace, kind of deciding whether it is whether or not to go with on-site versus virtual or remotely accessed initiatives, or, you know, and also like finding the right balance of both of those. Obviously, for most programs now, for the clients we work with, the most organisations are, you know, having a mix of those to provide equity of access across the board. But it's finding, the struggle really is the right finding the right balance between those two, and then being able to measure, will really understand from their people, do we want to prioritise those remote initiatives, or do people actually want to come back in and focus on their wellbeing in the office? So that's probably been the biggest one for me, is the uncertainty around that and finding the right balance between virtual and on-site.
Yeah, that's a really good one, Trent, and that's probably a challenge for us as service providers as well, isn't it? Because it's not only the the challenges that have been mentioned in that little quiz we did just then, which have been connection and what was the other one? Actually, I have to go back now.
Lack of data.
Lack of data. But the other challenge has been, well, the actual being able to map out a plan and to confirm the logistics, because let's face it, the last 2 years working in employee wellbeing, it's been really hard to plan ahead and really hard to lock in with any sort of confirmation the next stage of wellbeing program. So thankfully, I don't want to jinx us too much here at the moment, but a lot of the workplaces that we work with at the moment are having a lot more consistency in being able to map out, not just be reactive and map out the next couple of months, but start to plan their 2023 wellbeing program. So you're spot on that employee health checks and measuring wellbeing has been affected by that quite heavily. So that's a really good one. Now, all right, so again, no doubt there's going to be a range of different levels of people here on the call or listening. And by levels, I mean, you've probably got a whole range of understanding of what a health check is. You may have delivered health checks before, you may not have. But really what we're all about in this session is working out, well, what sort of things can we measure when it comes to employee wellbeing? How do we do that? And then from the information or the data that we've gathered, how do we then use that data to make decisions to really get the most optimal or the most efficient wellbeing program moving forward? So the first thing we really need to do is define, well, what is it? What is a health check? And health checks really serve many purposes in a workplace. The first of all, it sounds extremely obvious to say, but I'm going to say is to assess health and wellbeing. So it's like that really old adage, what you can measure, you can manage. If you don't have any data, like we mentioned before, it's really hard to make decisions on how well things are going and then make decisions on what we need to do to improve it. The other fairly might seem obvious benefit or reason for doing health checks is to identify risk factors with health and wellbeing. And using those risk factors or identifying those risk factors, using those to prevent sickness, illness. Now, chronic disease, being a Western country in Australia where we're dialing in from today, chronic disease accounts for most morbidity and mortality across our country. And in terms of the risk factors associated with that, the working population across Australia are represented very, very heavily when it comes to chronic disease risk factors, which we're going to touch on in a moment. Okay, so effectively what we're really saying here without saying it is that lifestyle factors, things like exercise, nutrition, sleep, our own mental well-being, our relationships, they have a huge bearing on our overall health and well-being. So health checks are important because we need to measure not just our current status of health and well-being, but in which areas that we might be struggling, both personally as an organisation, and therefore what intervention, what education and what different interventions we need to implement at our workplace in order to improve that and to prevent chronic disease risk factors from happening. To promote awareness and education, so simply by having, hands up, who's been to the doctor and you've gone through an assessment and the doctor has drawn light to some kind of risk factor or some part of your health that has then inspired you to go do something about it. So it might be, we're running skin cancer checks at our workplace at the moment. The first thing that comes to mind is that when you get a skin cancer check done, you immediately are way more conscious about using sunscreen. You're way more conscious about being out in those peak UV times throughout the middle of the day in Australia. So simply by getting assessed or simply by getting some metrics associated with your health, you are way more likely to do something about it straight away. Okay, it comes back to what you can measure, you can manage. Increasing physical activity, enhancing nutrition. So I kind of touched on that before with the risk factors and the chronic disease, but certainly when we hone in on health checks, and particularly the cardiovascular health checks that we'll touch on, physical activity, movement, exercise, eating well, that they feature heavily in that. So that's sort of an overview of what health checks are and what they measure. Now, I sort of alluded to this before, so it looks like it's come out a little bit funny in the formatting of this presentation, but basically population health. So just to throw some statistics at you, and there's loads and loads of these that don't just feature when it comes to workplace health, but are looking at the overall population. There you go, a third of us, so a third of working age Australians suffer from at least one chronic disease. So that means that a third of us have at least one of things like diabetes, cardiovascular disease, respiratory disease, obesity. And these are, as I touched on before, that make up the largest part of morbidity and mortality in Australia. Another one, so 1 in 5 of us, so 1 in 5 Australians have 2 or more chronic conditions, okay? So not just one chronic disease or one chronic disease risk factor, but 2 or more, okay? And often those different chronic disease risk factors go hand in hand, okay? Think obesity and diabetes as 2 that go together, obesity, cardiovascular disease, etc. A third, so proportion of the average lifetime spent working. So again, you can't really see it that well with the formatting, but we spend a third of our lives working. So when we combine some of those population health statistics and we look at how many of us have chronic disease risk factors, and we look at that we spend a third of our lives actually working, well, the time we spent working or the time that we contribute to working really shapes our overall health. So it shapes our nutrition, it shapes or heavily influences how much we move. It does influence our relationships. So if we don't have great relationships at work, it can affect our mental health and then in turn affect our physical health and so on. So again, I'm probably really laboring the point here. Apologies if this is all quite obvious to you, but it's certainly really important to understand that the work that we do and the environment that we're in does influence our overall health and disease risk factors as well. And then finally, more of an objective metric here, or a bit more of a red brain metric in the financial side of things, is that the annual cost to workplaces per employee chronic disease risk factor, this is a bit of a mouthful, is over $2,500 per risk factor. So basically what that's saying is that for each employee that has a risk factor to do with chronic disease, it's going to cost that organisation $2,500 per year, or a bit more than that. So obviously that adds up, because if we combine that with 1 in 5 Australians have 2 or more chronic conditions, well, we've got a fair problem on our hands there. So generally speaking, the cost of being unwell at an organisation and not measuring that in the first instance can be hugely costly. All right. So this is probably a good time to ask us, and for those that are on this call, I'm probably making the assumption that some of you either know what a health check is or know how to measure health of your organisation. But the question here is a very simple yes or no. Have you conducted workplace health checks before at your workplace? So jump onto that same Menti link if you can, and it's a simple yes or no. So, and hopefully we've got a nice snapshot. Don't worry, it won't mean if you say, yes, I have, that I close the session 20 minutes in, because there's lots that we want to talk about through the benefits and actually how to do it and how to optimally engage people. But yeah, we look like we've got a bit of a half and half split here at the moment, which is perfect. So again, that tends to be pretty reflective of what we see with our workplaces. If you've just jumped on the call, or if you're listening to this and only just tuned in, we work with over 200 workplaces. Not every one of those workplaces do conduct workplace health checks, but we're working on it. And the reason I say that is not in a way that means everyone has to do health checks, but without having the data or having that information for these organisations, it makes our job a bit harder to build out their wellbeing program. So yeah, that tends to be pretty well reflected snapshot that about half of our clients would have already done health checks before. You might have delivered them at your workplace, but you might be new in your role and you haven't personally been involved in it. You may have received a health check and been an employee that has had one, but haven't been in charge of actually getting it done. So anyway, thank you for completing that. So that then kind of leads us straight into why would you do them in the first place? So it looks like half of us have and half of us haven't, but why bother? Why deliver workplace health checks at your organisation? So we really break the explanation of why to do them down into two parts, okay? The first part really is probably the most important. Well, not probably, it's definitely the most important part, and it's really why we do these in the first place, which is for the employee. And it's really in order for that employee that's on the receiving end of the health check to identify how their health and wellbeing is going at that point in time, and then be able to do something about it, to be able to make change or to be comforted that they are actually going all right from a health and wellbeing perspective, and then adapt their lifestyle and their health and wellbeing around that. So that's the first and arguably the most important one. The second benefit and probably the one that really speaks to you guys on the call here as leaders, is to the employer or to the leader in yourselves, is it gains an insight into the data of your workforce. So we spoke before, one of the challenges or one of the pain points of delivering health checks has been not enough data or delivering wellbeing. So by delivering workplace health checks, it's really obvious now, we've already spoken about it at length, but by delivering health checks, you are actually getting a report, you're getting an overview of the health and wellbeing of your population. Let's get into that in a little bit more detail, and I will throw Trent as Pinnacle Health Group's National Health and Wellbeing Manager, delivers most of these programs. So certainly Trent can speak to a lot of the information that the employees themselves will get, and also what the employers get in terms of the report. But I might start that one off, Trent, and then throw to you. But as we spoke about before, there's really two major reasons or two subcategories of stakeholders that we're delivering health checks for. The first of all is the employees. So we want employees at workplaces to be aware of their wellbeing and to know what they can do about it. So like it says there, to know their numbers. So a preventative screening assessment, a skin cancer check, a health check, they are the sorts of things that we can deliver. What's the employee experience like? Well, they go along to this health check or this skin cancer check. They go through the assessment with their health practitioner, so the expert in the room with them. It might even be a virtual session that we'll go through later in the session. But what that employee will leave the session with will be an awareness of their overall health and wellbeing, any risk factors, so any risk factors to those major chronic diseases that we spoke about before, and then guidance from that health practitioner of what to do about it. Trent, I might throw to you here, and you can see for the audience that are watching on, just some screen grabs of some of the information that these employers receive. But Trent, did you want to go into a little bit more detail of perhaps that employee experience for their health checks?
Sure, thanks, Josh. So yes, as you can see here, guys, like just to provide some clarity, I suppose, as well, as we think about health checks as both, skin cancer checks and the traditional health check. So hence why you can see some information there in regards to skin cancer check. So I suppose Josh has talked about knowing your numbers and kind of from the user end or the employee end, what you'll walk away with from a health check. And if we talk to the skin cancer check piece of that, I guess the key things that we're going to know there are, number one, what is our skin cancer risk score? And number two is, what is our current skin damage? Are we low, medium, kind of high range in that area? The other thing we're going to know from that is, do we have any suspicious lesions that are worth keeping an eye on, essentially? And how regularly we should, what are the next steps with that? How regularly should we be checking in on our skin health? So is that, have another check in 12 months? Is that we recommend that you go and see your GP or a skin cancer specialist, like further skin cancer specialist as soon as possible? Or is it, maybe keep an eye on it and just track the progress over the next couple of months? So that's kind of what you're going to take away from a skin cancer check. From the health check perspective, I guess it's a little bit more broad. As Josh has touched on, the key areas that we're going to talk to and through your screening as well with our health practitioner would be lifestyle factors such as alcohol intake and smoking status, along with covering the key pillars of exercise, nutrition, sleep, and Jenny will touch on emotional or a little bit of mental well-being as part of that as well. So they're the kind of areas that we're going to screen across, and then obviously, which I know that Josh will get to further in the presentation, but you'll receive your pinprick, your bloods. So we're going to walk away understanding our whether our risk factors or our risk status across our diabetes and cardiovascular disease as well. So obviously, from an employee perspective, it's a really well-rounded snapshot of where they currently are. And as Josh has alluded to before, it's the really powerful thing here is creating that awareness that, okay, these are the areas I need to focus on, and receive that counselling as to how you can practically implement those into your day-to-day, and who's the best person to go and seek further assistance from in the short, medium, long term.
Yeah, thanks, Trent, for going through that. And as you were going through it, I think a really, really important point to note was you spoke a lot about the lifestyle parts of that, and it's quite small in this. We literally just grabbed a few screen grabs of a couple of random pages of the patient information booklet or the results booklet that employees get. But it's important to note that those lifestyle questions are almost that first line of defense, or that first bit of information that the employee has got to then do something about it, or be aware that they're not quite in the right category. And just to talk to some statistics around that, Trent prompted me to speak of working age Australians. So it might seem really obvious, okay, smoking's not great for you, alcohol, etc. But even things like vegetables. So in terms of nutrition, only 7.5% of working age Australians are actually consuming the recommended dosage of vegetables and fruit per day. So I'll say that again, only 7.5% of us are eating enough vegetables and fruit in our day, which sounds crazy, but it's true. Sleep, only a bit over half of us are getting enough sleep of working age Australians, and only 30% of us are actually exercising to the recommended amount. So again, it might seem obvious. You might work in wellbeing and you think, well, I've got those covered myself. But for some of your employees, this is the first line of defense. These people might not be going to doctors, or might not have that health information available to them and do something about it. So anyway, thank you, Trent, for going through that. Let's progress. So we've spoken about the benefits to employees, which again might seemingly be quite obvious. The benefits to the workplace. And again, this is probably why you're here today, because you want to know, well, what information do I get? How can I use this information, and how can that really direct our resources and attention to actually improve the benefit, improve the well-being, I should say, of our workplace, which is why you're here. So, so as opposed to the personal information booklets that employers get, you as a workplace get an overall snapshot. Now, need to be really clear that it's de-identified information. So what you won't get of the organisation is that Josh had high blood pressure, or Trent, hasn't been exercising enough, or whatever it might be. If you have 100 odd employees, you'll get an overall snapshot that says, of your 100 employees, the weekly exercise frequency was this, or average exercise frequency was this, alcohol consumption fitted into this, sleep fitted into this, as you can sort of see with the screen grabs we've shown there. So that's what you receive as the employer. Same thing with the skin cancer checks, as Trent mentioned before. So the employer receives their personalised booklet. The employer receives the overall snapshot. So this one here, you can see 171 employees attended the skin checks. The average age was this. One really important one to draw attention to here, if you can read the tiny font, is the first skin check. So 56% of this particular workplace, it was their first ever skin check that they had conducted. So, and I think when our overall average of skin cancer checks, with this particular statistics, I'll explain this a bit better. 71% of employees that have a skin cancer check done through Pinnacle Health Group at work. So 71% of employees that get a skin check done, it's been their first ever skin cancer check anywhere. So they've never been to a doctor to get it done. They've never been to a dermatologist. They've never had it done. So if we think of where health checks and skin checks fit in a primary health perspective, well, we spend a third of our lives working. If a workplace can offer these, as you can see with this client, 56% of their employees had never had one done before. And if you go down to the risk score and how many suspicious lesions were found, which was 32, and 15 of those employees were referred to the GP, that's potentially 15 lives that have been saved that would never have had that done. So you can see my eyes light up, and this is why we get so passionate about what we do, because this is literally saving lives by measuring this wellbeing. So anyway, I've honed in a bit too deep there. If we take that step back again and go, well, what other information, what do you get from that information as a leader? It allows you then to target your interventions. So let's say in this case that in terms of the statistics that were gathered, that exercise was okay, as in most employees were exercising to the desired amount per week, but nutrition was horrible. I said before, 7.5% of working age Australians aren't eating the right amount of fruit and vegetables. So as a workplace leader, you can then identify from these health checks, well, we need some more information on nutrition. We need our employees to know that they should be getting 5 servings of vegetables per day. We need for them to know that they should be eating 2 servings of fruit per day. How do we make that practical without just telling them to do it? Can we do things like live cooking demonstrations? Can we get some dietitians on site to do some dietetic assessments after the health checks? Can we set up a nutritional challenge over a month? Can we share healthy recipes? Those sorts of things. So again, you can see the passion coming out, but this is the sort of things that once you get that overall snapshot of information, it can then, you and your wellbeing committee or the team that works on this can then really hone in on the areas that need to improve. It's going to maximize engagement as well. So by measuring health, you know, let's use the example. If we didn't conduct health checks or we didn't do skin cancer checks, if you then say, hey, everyone, we're delivering a workshop or a seminar on healthy eating or on being safe in the sun, you're going to improve the engagement in those workshops or seminars by having individuals measure their health, because they're going to go, actually, yeah, I didn't score that well on my skin cancer risk assessment, so I should come along to this workshop. Or my health check score wasn't fantastic, so I'm going to come along to that nutritional workshop as well. It works back the other way. So if you deliver some education up front on the importance of nutrition, the importance of being safe in the sun, you're also more likely to get employees engaging in the health checks. So I digress a little bit there, but there's some of the benefits to you guys as workplaces. Finally, there it often, you know, it all goes hand in hand, but saving lives is a huge one. I spoke about that before with this example that 15 employees had potentially life-threatening skin cancer checks removed from a GP. So that's huge. But then we start talking about the financial aspect of it. And obviously, we said before that for every chronic disease risk factor for an employee, it's a cost to your workplace of $2,500 per year in either direct or indirect costs. Sickness, absenteeism, presenteeism, you know, work cover claims, those sorts of things. So anyway, I'm really honing in on this, but it's important to understand why you do this in the first place. We are going all right for time, but for this one here, I just wanted to really show where health checks kind of fit into corporate wellness or corporate health as an overview. And again, sorry that the formatting has come up a little bit funny with our fancy new branding, but basically workplaces, you guys might be in this situation as well, that you've got lots that you need to consider. You've got EAP programs, you've got mental health services, you've got employee benefits, there might be gym memberships or discounted fitness programs, those sorts of things. So there's lots for you to consider, and you might be thinking, well, health checks are just one other thing. Why focus on that, or how frequent or prevalent are they in most workplaces? So to give you an idea, statistics on corporate health from 2018 to 19, that health checks are nearly 40% of what workplaces deliver. So I'll say that in a more articulate way, that of all the different services delivered to workplaces, health checks account for 38% of those. So they're the second highest to health and fitness programs, but I kind of touched on this before, that health and fitness programs could be as simple as like a discounted gym membership or a partnership with a gym where they get a voucher for a free class. So in terms of actually services delivered and resources and spend directed to employee health, health checks are effectively the top of the list when it comes to that. The next one, education and training. We said before that they kind of go hand in hand, and then mental health. But mental health at 4% in 2018 and 19, that is only on the rise at the moment, which I don't probably need to tell you guys too much either. Any questions at this point in time? Sorry, I get carried away when it comes to talking about the benefit of these, but any questions at this point, guys? Feel free to jump in the chat box or ask the question directly. All right, we must be going all right then. Cool. So we've just touched on where health checks fit into overall corporate health services for your workplace, and we said that nearly 40% of wellbeing services are health checks. If we go a step further and break down the common workplace health checks, We've got biometric health checks, which we often just call health checks or heart health checks, cardiovascular health checks. They are the ones that look at the lifestyle disease. They look at the pinprick blood test, which I might get Trent to touch on in the next slide or two. They are the most common of all health checks. They're almost half of all health checks. And for good reason. As we touched on before, they give a really nice overall snapshot of health and wellbeing. Skin checks are next in line. They are obviously specific to skin cancer risk, prevalence. So basically, skin cancer checks are also on the rise, given the intensity of our sun in Australia and New Zealand. But certainly, the biometric health checks are the most sort of well-rounded or all-rounder health check. Skin cancer checks, and then vision and hearing checks are quite well represented there as well. They're often almost mandatory in a lot of blue-collar organisations to go through those. But certainly we're seeing a bit more of that in all organisations as well. It might seem a bit funny, but more screen time. Vision checks are becoming very important, and hearing checks, so more headphone use, devices and so on, meaning that it's leading to some more hearing issues as well. But certainly that has previously been more of seen as a blue-collar hearing check. So that gives you a bit of an idea of some of the different types of health checks. We're going to speak a bit more specifically on the biometric. There's a really, sorry if you get a bit queasy if it comes to looking at blood there, but there's a nice image that gives you an idea of the biometric health check and the skin cancer check there. So I think this is probably the best slide in order to speak of it. But perhaps, Trent, I might throw to you here just to explain the process of the biometric health checks or the heart health checks first, and then the skin cancer checks, just in an overview for these guys that are listening.
Thanks, Josh. So yeah, if I talk to the health check side of things first, so basically what the employee will receive is, as we've touched on, is the pre-screening or the health risk assessment screening, which they'll receive prior to their consultation, and obviously that will allow the practitioner to be, prepared for, all of their background information and lifestyle factors up front. Once they actually, on the day, during the delivery of the check, they're going to receive things like blood pressure, waist and hip measurement and waist to hip ratio, which is obviously an indicator of cardiovascular risk, or cardiovascular disease risk, I should say. They're also going to receive the pinprick blood test. So obviously that's the key, one of the key data pieces that we're talking about here. So from that, they'll understand their blood, random blood glucose levels. They'll understand their total cholesterol, their HDL cholesterol, and total cholesterol to HDL ratio, which is again a risk factor for cardiovascular disease. So they're going to walk away with some really key data there from that, along with the lifestyle counselling, and that will obviously then lead to recommendations from the practitioner on what are the next steps for seeking further advice, or how can they, what are the key areas that they can focus on in their day-to-day life to look at bringing down their cholesterol, for example. Is that moving more? Is that exercising? We've noted that your exercise is not reaching the recommended weekly levels. So it kind of all comes hand in hand and talks to those points that the practitioner will have seen from the health risk assessment screening, I suppose. So they're probably, really high level. That's what it will entail. And then, as I said, a recommendation to seek further advice if required. From a skin cancer check, as I mentioned before, each employee, like the process will be that the dermoscopist, so for all of our services, they're highly qualified in skin cancer detection and dermoscopy. So the employee will go through a bit of a background or assessment on their ethnicity, time in the sun, family history, these sorts of things. So a bit of an overview that the practitioner will run through, and then obviously going into a full head-to-toe 15-minute assessment of their skin. So you may have, if you've run these before, you may have heard that there is kind of two types of skin cancer checks. One is measuring or looking at only the exposed areas, which is usually in a shorter check. We generally don't deliver that check. Our most popular is the 15-minute head-to-toe assessment. So that'll get right into areas like the scalp and back, and even under the eyebrows, and these sorts of things that obviously areas that you wouldn't necessarily notice yourself as the individual. So the dermoscopist will kind of deliver that 15-minute head-to-toe assessment, and then obviously indicate whether if there's any specific lesions that need immediate referral, or whether they're kind of urgent, medium, or I should say high urgency, like as in go and get a referral. It might be kind of moderate, so check that, keep an eye on it. In 3 to 6 months, maybe go and get another look at that, that particular spot or lesion. Or it might be, look, I would just recommend you look at your skin's looking fairly healthy, but what I'd recommend is if you're accessing this service via your workplace again next year, or in 12 months' time, go and see a skin cancer specialist, just to keep an eye on the overall health, which would be the general recommendation in any case. So that's hopefully that makes sense and explains the process, and then what the education or the next steps that the practitioner would talk to for each of those employees.
Yeah, thanks, Trent, for sharing that. And again, guys, if you have any questions, we're now about to get into the part of the session where we talk about not just what are health checks, why do you do them, and specifically what health checks are the most common. We're going to get into how to make them work and how to use that information. But just before we get into that part, are there any questions on those common workplace checks, on how they're delivered, on what they assess? I know it feels like we've spent a fair bit of time on particularly the heart health checks and the skin cancer checks, but did you guys have any specific questions on either of those? You can throw it in the chat box. You can ask it live, entirely up to you. If you prefer after the session as well, if there's any questions that are specific to your organisation that you don't want to share on this, you're welcome to respond to the email that Trent or I will send you as well, and ask more specific questions. One thing just to note as well, and we showed that back at the start. I might even actually go back to show the slide with it. But this sort of information here, so Trent made a really good point there before, that often when people get their first skin cancer check done and it's kind of all clear, as in it's a low to moderate risk and there's no action required apart from getting another skin check done in the next 12 months or so. That's obviously a good result, but to the employer, they might go, oh, okay, I was maybe hoping to find something, which seems weird. I mean, it should be good being told that you don't have any skin cancers, but because of the skin cancer risk assessment and because of the booklet that's provided, it's still really tangible information. So even if that employee is getting a skin cancer check done and it's a fairly benign one, that there's nothing found, it's actually a really good result to say, well done so far, but here's still what you need to do moving forward. It's not just no, you're fine, don't worry about it, see you later. There's still something tangible moving forward. The same thing goes with the essential health check. So even if that particular employee might tick average or normal category for most of those and are in those different ranges, there's still that opportunity to speak to that practitioner about their overall health and well-being. And we're about to get to sort of how to engage people, and particularly those sort of not so engaged employees in wellbeing checks as well. But just thought I'd flag that. All right. Sorry. Josh,
really quickly, can I just jump in there as well? And the other important piece to note there, I suppose, if you are delivering these checks, is if you're delivering them via Pinnacle, obviously we provide you with a comms pack as per any other provider. I'm making the assumption, but it's important to note and communicate to the employees that this is really the first line of defence. And it's providing that broad snapshot of where you're at and then recommending steps to take from there. So that's probably, I know that on occasions, and the reason I thought of it was because Josh mentioned sometimes the disappointment or for employees when there's no real action from it other than have another check in 12 months. It's kind of like, oh, well, where was the value in that? On occasions from the odd employee, we get the feedback. So I think it's really important to push on that point and say, well, there's two things. One is going to be peace of mind that you are really healthy and that you're doing the right things to manage your overall health and well-being. Or it's like, okay, well, great, I didn't realize that I wasn't hitting that weekly recommended exercise, or the weekly, the daily vegetable intake, for example. So it's either peace of mind, or it's what are the key actions. But it's important to also set the expectation. This is the first line of defense. I'm not going to walk into a skin check, and if I have a lesion in this workplace check, I'm not going to have that burnt off by a practitioner on this day. So those sorts of things as well, just to be really clear and upfront as to what these services are.
No, thank you, Trent, for clarifying that. And then that sort of leads us into really the last part of today's session, which is, all right, so we know what health checks are, we know where they fit in. How do we use them, not just as some information for the employee and information for us, but how do we really strategically use that data and actually be really forward future planning? How do we future-proof our wellbeing program and actually really cut to the chase of where those wellbeing barriers or challenges are at our organisation? And just to use, I'm a physiotherapist by background, but we often talk about assess, treat, reassess as physiotherapists, which is you assess a person, you then provide some treatment or exercise or intervention, and then you reassess. Well, it's exactly the same at a workplace. You need to assess the wellbeing of your population, be it by health checks, be it by skin checks, be it by wellbeing surveys that actually measure how employees are going at work, how they are getting on well with their fellow colleagues, etc. No doubt you guys might have those sorts of things, but you assess, you provide an intervention, which is inspiring change, and then you reassess. So health checks aren't something just to do once and go, cool, all right, in 2022, 40% of our employees were sleeping okay, and only 20% of our employees were consuming the recommended fruit and vegetables. It's really then to go, well, if we target some intervention towards nutrition and sleep as an example, let's reassess that in 12 months. Let's look at the benefit of our intervention, because no doubt, this happens with the 200 workplaces that we work with, is that there needs to be justification of the resources that you're, the budget that you're spending and the time you're allocating into your wellbeing program. So if you can't, as a leader, show that there's been some change or show that there's been some improvement in the overall wellbeing, it's going to be really hard year on year to justify doing health checks, to justify having keynote speakers or delivering different parts of your wellbeing program. So hopefully that sort of gives you a bit of an idea of why it's really important to use this information. Let's get to the how. So most of our clients, there are some of our workplaces that might engage us for sort of more ad hoc initiatives, but most of our clients, if they've been with us for more than a few months, start to understand that really wellbeing is not just a scattergun, random assortment of different things throughout the year, but it's got to be built out into a program. So even our basic health check campaigns or skin cancer check campaigns, we build them out into a program. So with skin cancer checks, we would usually have a workshop or a webinar before the skin cancer check days. We would then have a comms campaign, as Trent mentioned before, that we provide to you, and you simply cut and paste that or use that through your different channels. There's online booking links for employees to book in. There's reminders. So we've got all the system in place to actually get bums on seats, excuse the French. Then you've got the actual delivery of the health checks. And then following that, the way the program is then rounded out is that there's all of that data that we've spoken about is then presented to you, presented to your leadership team, if that's necessary, to then pick apart the information and then provide our recommendations as to what next. So I just want to be really clear that health checks aren't just a thing like flu vaccinations where you just go, bang, that's done, what's next? They are something that are built out into a program in themselves. And then if we take a further step back and we look over a 12-month period, well, as we touched on before, health checks might be one campaign or one initiative that you're delivering. You might also do skin cancer checks. You might you might get to do flu vaccinations at your workplace as well. You might have nutrition. So just to give you a very basic example, here's what a few months of an annual program might look like. So each of these months here, they have a different wellbeing theme. In March, they conducted their skin cancer checks, this organisation. In April, they delivered their flu vaccinations, and they built that out with some immunity boosting recipes on their intranet just to really improve that engagement. May was Mindful May. June was winter nutrition. And then July was where they delivered their health checks. So that's where they actually conducted those heart health checks and measured all the things that we just mentioned. So that's an example of where it might fit into the broader program, because no doubt if you're on this call or you're listening here and you're going, well, that's great, but I've got to do EAP and I've got to do flu vax and all these other things. Well, this gives you an idea of where it might fit in. Okay. And then if we get into really how to actually deliver the health checks, and we've sort of touched on that a little bit, but just to go through it step by step, we spoke about that the health checks or the skin checks, we actually package that together as a program. So it's not just tell us how many days you want. There you go. There's the booking links. See you later. We actually build that out into a fully engaged program. So to go through it step by step, you as the workplace, you will select which type of health check that you feel necessary. So again, to go back to that example, you might go, this organisation have conducted skin cancer checks and health checks. They've also conducted flu vax, but the health checks they've selected have been skin cancer checks and health checks. Once you've selected the types of health checks and when you want to deliver those, we then need to know, all right, well, what's your total population? So how many employees do you have? Where are they located? Are they on-site? Are they remote? Are they across multiple hubs? Are they in a few hubs? And then based on those employees, because we've delivered, hundreds of these different programs, we can then estimate the actual engagement that we feel will be achieved. So therefore, how many employees of your 1,000 employees will actually get health checks, or how many of your 200 employees will get health checks, and therefore what that'll cost you as an organisation. And then it's just down to logistics. So then it's, all right, well, we know that we've got 4 locations, we've got 30 employees here and 50 here and 10 here. Here's what we recommend based on those locations. We're going to do 3 half days here. We're going to offer remote virtual health checks for these remote employees, which we'll touch on in a moment. And then, as we said before, because we've done this so many times, we know that successful health check programs are only as good as the comms and the engagement piece. So it's a fairly detailed promotion campaign that we roll out. You funnel that through your various channels. Once that's achieved, the employees then book online. We fill up the slots. They come along, they attend their health check or skin cancer check or whatever it might be. And then the employee themselves get their information. And you guys, as the workplace, we then sit you down. We go through the data. We don't just give you a PDF and go, there you go, interpret that. But we sit down and we work out what does that mean and what can you do with this information. So that's really our best in class or best practice way of how to deliver health checks. And the ones that we've really honed in on there have been the comms and the promotion, because I've seen a lot of organizations that don't really get the comms or the promotion right. They just go with the cheapest provider. They go, cool, that looks good, let's get it done. But it starts to cost you a fair bit if no one comes along to these health checks, or if there's no shows on the day. So that's sort of the best in practice how to do it. Other things, some take-home little gold nuggets for you guys from this session. The average engagement in health checks is approximately 30% of your workforce. That does vary. So if you have more employees, if you're in the tens of thousands, you might not get 30%. If you're lower numbers, say less than 100, and you're all in the one location, you might get more than 30%. So it does vary quite a bit. Other things that you need to consider are space and privacy requirements. There's some derobing required when it gets to skin cancer checks. So do you have a meeting room that is fully enclosed, or can there be blinds? Or sometimes we've had to put butcher's paper up and so on to make a room appropriate for skin cancer checks. There are on-site and remote options, which we're about to touch on. On-site is still the gold standard. So I want to be really clear here that yes, there are remote options for health checks, skin checks, and so on, but it still doesn't replace what is conducted on site in terms of the quality and the inter-rater reliability of health checks. And the other thing to consider are how can you increase your comms channels? How can you get champions in your organizations to not only attend the health checks themselves, but to get other demographics or other cohorts of your population to get involved in the health checks as well. So that's probably really brings us to the end of this session. I do want to leave some time for some questions, but just to round out sort of health checks, where they fit in here as well. if you followed Pinnacle Health Group for a while, you'll know that we've got a 5-step program to delivering a broader wellbeing program. Those 5 steps are structuring a program, making sure there's psychological support, having awareness, so having really good comms and promotion, having a wellbeing champions network within your organisation, and then actually measuring wellbeing. So really where this fits in, it's very much in the evaluation or the measurement of wellbeing side of things, but certainly it almost incorporates every other part of it as well, because really health checks are a huge part that they can often dictate the rest of the wellbeing program. And then, yeah, finally, sorry, I know we're cutting it pretty tight for time here, but just to touch on, I promised I'd speak about sort of some more hybrid or remote options to do with health checks and skin checks. There's a virtual wellbeing check that we offer. It's pretty much the same as a health check, but it doesn't conduct the pinprick blood test. It goes through all the lifestyle chronic disease risk factors. It goes through some different, like the DAS21 and some diabetes checks and so on. It's a really good option if you've got employees that are in remote locations or small hubs of employees that you just want to get that overall information, but it doesn't need to be too specific, like the cholesterol stuff. That's a really good option. There's a remote skin cancer check option, which actually uses an attachment to a smartphone, and you can be taking smartphone photography via this attachment, and then the skin cancer check is conducted remotely. Again, it doesn't beat the on-site option, but if you do have remote employees, you can go through that pathway. There's also a voucher option. So we have some skin cancer check vouchers that employees that work remote might be able to access a number of different skin clinics and do it in their own time. So there's some of those options for those remote locations. And finally, just to finish this, really looking beyond next year, health checks are something that need to be equally accessible to all employees. So it's not enough just to say, well, we're going to roll them out at head office, but we're not going to worry about the remote employees. You really need to think about some options to measure wellbeing in those remote locations. Can they come into head office? Can we bring them in for something else and measure wellbeing while they're there? Or do we have a remote option that can go to them? So they're the sorts of things that you might be considering here at the moment. So, sorry, I've gone a minute over time. I might sort of just, maybe hand over to you guys now for any questions and go from there. So feel free to jump in the chat box if you have any questions, or you can ask Trent or I any questions. Have I kind of rushed through the last slide or two there. Trent, was there anything else that you wanted to add while the others maybe consider some questions?
No, nothing too much there other than what you've kind of covered, Josh. I think, it's just really for us, like I suppose the one thing that I can say is that we're seeing at the moment is definitely a huge demand for skin checks right now for what we're seeing from our clients or prospective clients. So skin checks to roll out for a lot of program launches in that kind of early Feb to March kind of time period, and then health checks kind of more around the middle of the year after the flu vaccination program. Or on the flip side, a lot are also, a lesser amount, but some are saying, well, we want to really measure the health of our employees right at the start of the year. Also, when employees are really, a lot of us have got New Year's resolutions and are really health focused. So it's a great time to kick off your program at the start of the year with health checks. And as Josh has talked about in a lot of the presentation today, we can then use that data to really leverage what do we do for the rest of the wellbeing program throughout the year. So yeah, health checks and skin checks are going gangbusters at the moment, and you can, if you're thinking that you'd like to, engage in one of those or both of those services, you really can't go too far wrong as to when you position them. But skin checks, are obviously October to March really popular, and health checks more so in the middle of the year, but can be done really well at the start of the year. Just to share what a lot of our clients are, what we're talking to our clients about at the moment as well.
Oh, awesome. Feel free to jump in, guys. I can't see any questions in the chat box, I think we're all good there. Yeah, if there's any questions at all, feel free to hang on the line. You can ask us some questions directly. Okay, well, thanks Nadine for jumping on. Hopefully you got something out of that. Appreciate you jumping on today, and yeah, hopefully some good insights. And yeah, but before we sort of close, and again, feel free to hang around for some questions. But thank you for those that jumped on. Thanks that are listening to the recording that couldn't make it. Appreciate it. Hopefully you got something unique out of it. Any feedback that you have, you're welcome to respond to the emails that you'll get from us. But yeah, thanks again for coming along, and good luck for the rest of the year with your wellbeing. And if you need any help with any strategy or building out some health check campaigns at your organisation, feel free to reach out to Trent or I. Thanks a lot, guys.
Thanks, guys.